I'm just presenting to you the long-term evidences from the MeRes-1 3 years outcome and MeRes-1 Extend, which is the 2 years outcome, which was done later on. So with this, I'll go to the next. So this is the comparison. I think you already showed that this is a 100 micron MeRes-100 stent, and it is like 24% scaffold artery ratio, and the crossing profile is much lesser, like 1.2 compared to 1.4 of absorb, and the markers are 3 compared to 2 markers for the at each end with the absorb stent. So that is the difference. And the interesting aspect is that the storage was happening at cath lab temperature, which was also quite exciting. So this, I think, you have already shared that this is the structure of this absorbable scaffold. And as you can see here that, at 2 years, we hardly find any empty boxes here. However, with the absorb, we did boxes, the full empty boxes at the end of 2 years and even 3 years. However, I have done many, check angiograms now in the last, year and this year also, with both types of these stents, the absorb stents and also the MeRes which we did. And I don't find any, even with the absorb stent, I don't find any boxes at 7 years, because just recently I did 2 patients who underwent an angiogram. There was nothing left. So I think technology works, and it is just a matter how much it is there. So with 100, I think this will be much faster than the 150 microns, which are stuffed inside. So this is the 108 patient study, which was done with the MeRes-1, which was done in India. And you can see that we followed these patients starting from 30 days to going up to 3 years. And in here, angiographic follow-up was 2 years. And as you can see here, OCT and IVUS was also done in a reasonable number of these patients. So these were the key inclusion criteria. The vessel sizes were ranging from 2.75 to 3.5. And if the patient had low ejection fraction, they were excluded. Lesion lengths more than 20 were excluded. And of course, the flow had to be more than TIMI-1 when these patients underwent intervention. Significant calcification lesion and severe tortuosity, as Sanjeev you already showed, were excluded from this initial study. And the safety was determined by MACE at 6 months, which was the primary endpoint, and the secondary endpoints was device and procedural success and scaffold thrombosis. And for the efficacy, as you can see here, QCA, OCT, IVUS evaluations were done along with the angiographic evaluation. This was the study group, and we had the core lab from Cardiovascular Research Center from Sao Paulo, and IVUS OCT was analyzed at Cardialysis Rotterdam. So that's how we progressed with the study, and certainly we saw these 108 patients with the mean age of 50 years. So you can see these are younger patients compared to elderly patients from absorb, and large number of these were males. Diabetes was 30%, as is usual in many of our studies from Asia and India. And you can see hypertension again is 45%. Previous MIs were about 37%. And so unstable angina and silent ischemia was seen in about half of these patients. So ejection fraction was quite well preserved in most of these patients. So that's what the initial inclusion of these patients was, the demographics. And in scaffold late lumen loss, as you can see here, at 6 months was 0.13 and at 24 months was 0.24. So this was the result from the QCA core lab from Brazil. And this is the outcome, the OCT analysis at 6 months and at 2 years. As you can see here, the mean flow area was very well maintained. And the mean lumen area, the minimum lumen area again was very well maintained, starting from 6.5 going up to 4.29 plus minus 2 at 2 years. And the mean scaffold area was also 8 and did not shrink too much, as you can see here, 8.39. So that was the overall situation, and the covered struts were seen in 99% patients at 2 years. So that was very, very interesting. So that was about the OCT analysis, and the IVUS analysis, as you can see here, again shows that the areas, the lumen areas and the scaffold areas were very well maintained over a 2 years time. Starting from post procedure going up to 2 years, it was well maintained, and the new intimal hyperplasia was slightly, and you wanted it also some hyperplasia to happen, was 0.4 at the end of 2 years. And the volume obstruction came up to 7.5% at the end of 2 years. So that was the outcome. And the clinical outcomes up to 3-year follow-up was also very promising. There was no scaffold thrombosis. As you can see here, the cumulative MACE was at 3 years was 2%, which is again very exciting and very positive. And non-cardiac death happened in only one patient at the end of 3 years. So these were quite healthy patients because they were young patients, and as you can see, there was no MI, no cardiac death in any of these patients. So we were very lucky that we got these very positive results in the first study, which was 108 patient study. And then this is the result from the MeRes-1 Extend study, which is again a 64 patient clinical follow-up here, as you can see. And this was done by Dr. Alexander Abizade from Brazil. And again, 3-year follow-up was done. 64 patients underwent clinical follow-up up to 3 years. And these are the other centers which were involved in the study, from Dr. Rosli and then Indonesia, Dr. Sendozo, and from South Africa, Dr. Chevalier from France, and Dr. Angel from Spain. So again, this was a multinational study, and you can see the late lumen loss was 0.18 in the study as well. So again, consistent with the data from the MeRes-1 study. And you can see again, similar to the MeRes-1, here the covered struts were 97.9, almost similar. The mean neo-intimal hyperplasia was 1.5 at 6 months, and the scaffold area was quite well preserved with 5.9 at 6 months. So this is the 24-month follow-up of these patients, and you can see that the MACE was seen only in one patient, which is 1.61%. So cardiac death, MI, did not happen in any of these patients, and no non-cardiac death also. So again, very promising, very positive data from the MeRes-1 Extend study at 2 years. So basically, to conclude, the MeRes-1 trial, the first human trial with MeRes-100 stents with 100 micron struts, was very successful, high acute success, long-term clinical success up to 3 years, with a very low MACE rate of 1.87%, which I think is very, very promising. And the QCA at 2 years also showed very low late lumen loss. OCT at 2 years, virtually complete stent strut coverage, 99% and above. And IVUS at 2 years also showed a sustained mean flow area and very low rate of volume obstruction, 7.5%. So, and if we look at the MeRes-1 Extend trial, at 2-year follow-up, again, very low MACE rates and zero stent thrombosis. And if you look at the QC and OCT, again, very good strut coverage of 97.9% and low late lumen loss of 0.18. So I think, these two studies have really, established this device as quite a safe device, efficacious device. And I think with more experience and more studies, we'll have much more information. And I'm so glad that the stent has now been approved in India, and it is going to be available very soon. We have already started using the stent in many such many indications. And recently, when I used it in a in-stent process, which was being treated many times, and now this time we used a BRS for this indication.